It is Native American Heritage Month, and today we are talking to Dr. Don Warren. He is the director of UND's Department of Indigenous Health, the Indians into Medicine program, and the Master of Public Health program, all at the UND School of Medicine and Health Sciences. Welcome.
Thank you so much for having me.
Absolutely. So, Dr. Warren, we want to take time to focus on the important work that is being done at UND's School of Medicine and Health Sciences to improve the health and the well-being of Native American communities. So can you talk about what you've been up to from the halls of Congress to the Black Hills of South Dakota?
Yeah, quite a lot going on. First of all, we have the Indians into Medicine, or InMed program, and that's been around actually since 1973. So nearly 50 years of work in this space, trying to increase the numbers of American Indians and Alaska Natives going into medical careers. So we'll be having our 50-year anniversary of InMed in a couple of years, and we have a lot of events planned around that. In addition, very proud of UND, we've established the nation's first Department of Indigenous Health at the medical school. And within that department, we house InMed, several of our research programs, but also the relatively new PhD in Indigenous Health, which is also a very innovative program. So we've been able to focus on clinical training, but also research training, trying to address the health disparities that we face in Indigenous populations.
So back in August, just a few months ago, UND launched the world's first Department of Indigenous Health. So how does this new department build upon the work that UND has already been doing to improve the lives of Native Americans?
Well, it gives us an opportunity to collaborate across several different types of programs. We have our educational programs like the InMed and PhD programs, and we have several very exciting research projects as well that are within the department, including our new Indigenous Trauma and Resilience Research Center. And one of the things that we see in many marginalized populations is the impact of historical trauma or negative experiences during childhood that can have a long-lasting effect. But rather than just studying the negative impact of trauma, we also want to study the positive impact of resilience and cultural connectedness. So we're able to link our education, service, and research programs focused on Indigenous health under one umbrella. And we've been able to bring on quite a few exciting and very well-trained Indigenous health scholars as well.
That's wonderful. I love it. And always evolving, because we've got to keep doing that, right? So also, let's turn towards that ongoing pandemic. How can the UND Department of Indigenous Health be a difference maker in the fight against COVID-19?
Yeah, a lot of it is awareness and then trying to push back against misinformation that might be out there. It's been fascinating from a public health perspective to watch the pandemic unfold. And we have people who believe in the science and adopt things like wearing a mask or getting vaccinated and those types of things. But we have a large segment of our population that is also, in a way, not believing in the science. And that is a big challenge. And I think that for American Indian populations, the messengers matter. So if we are able to help lead the effort in communicating the appropriate information about how to address the pandemic and to protect yourself, your family, and your community, I think we have a real opportunity to help lead some of the communication and education around the pandemic.
Yes, communication is key, so definitely keeping that working forward. And then how is UND's Indigenous Health Department filling an important need for research in the Northern Plains, addressing that unique health challenges that Native American communities are facing?
Well, our PhD program is designed to teach students how to conduct research appropriately from a population health perspective. And when we started the program just a little over a year ago, we were hoping we'd have maybe 12 students per year. In the first cohort, we had over 50 applicants and wound up matriculating 19 Indigenous Health PhD students. Last year, we had over 100 applicants and wound up matriculating another 15. So we already have 34 Indigenous Health PhD students. And we've had over 300 inquiries into the next cohort, which will be admitted this coming summer in 2022. So we know there's a tremendous interest out there. And I think when we're looking at research, we're operating in the area of the unknown. We might have ideas or hypotheses, but we need to be able to ask the appropriate questions. And I think people who have lived experience and actually understand very directly what the challenges are when we're trying to improve health outcomes that has a meaningful impact on the quality of research that can be conducted. So we want to bridge that gap between cultural connectedness and very good science. And I feel like we're on a good path doing that right here at UND.
Yes, great idea, good information. Thank you so very much for being with us, taking the time today. Appreciate it.
Very happy to be here. Thank you.
Yes, and good luck with all your work. Kids ages 5 to 11 can or cannot get the COVID vaccine. Coming up on today's show, we're talking to a Sanford Health pediatrician about what parents need to know.